Imagine this. You wake up in the middle of the night, drenched in sweat, your heart racing, and you don't know why, or you walk into a room and completely forget why you're there. Maybe you suddenly feel angry or sad for no apparent reason, and your family is walking on eggshells around you. If you're over 45 and these experiences sound familiar, chances are you're in perimenopause or menopause. But here's the problem. Most doctors focus only on the most obvious symptom, hot flashes, and miss 7 other silent signs that can dramatically impact your quality of life. I'm Dr. Michael Turner, and over the past 20 years, I've guided thousands of women through this transition. Today, I'm going to reveal the 7 overlooked menopause symptoms that are often misdiagnosed as depression, anxiety, or simply normal aging. And more importantly, I'll give you a scientific 90-day protocol to restore your hormonal balance naturally. Stay until the end, because this information could be the turning point you've been waiting for.
Welcome.
Before we dive into the symptoms, we need to understand what menopause really is. Menopause is not a disease or a defect. It's a natural biological transition that every woman goes through. Officially, menopause begins when you've had 12 consecutive months without a period. The average age is 51, but perimenopause, the transition phase, can start in your mid-40s or even earlier and last up to 10 years. What happens during this time? Your ovaries gradually produce less estrogen and progesterone, the 2 main hormones that control your menstrual cycle. But these hormones do so much more than just regulate your period. Estrogen receptors are found throughout the body, in the brain, bones, heart, skin, bladder, vagina. When estrogen drops, every one of these systems feels the effects, and the decline isn't linear. In perimenopause, hormone levels fluctuate wildly up and down, leading to unpredictable symptoms that can vary from day to day. Let me tell you about Mary, 48 years old, elementary school teacher, married, 2 grown children. Mary came to my office with tears in her eyes. Her primary care doctor had prescribed antidepressants because she complained of mood swings, anxiety, and insomnia. She'd been on the medication for 6 weeks, but felt worse, zombie-like, and emotionally numb. "Doctor," she said, "I don't feel like myself anymore. I snap at my students. I fight with my husband over nothing. And at night, I lie awake, worrying about things I can't control. Is this life now?" I asked her one simple question. "Mary, how are your periods?" She hesitated. "Irregular, sometimes they skip a month. Sometimes they're very heavy. But that's normal at my age, right?" I ordered blood work. Her estrogen and progesterone levels were fluctuating wildly. Typical of perimenopause, her FSH, follicle-stimulating hormone, was elevated, a clear sign Mary wasn't suffering from clinical depression. Her brain was reacting to the hormonal tsunami sweeping through her body. I explained, "Mary, you're not crazy. You're going through menopause, and everything you're experiencing is a direct result of that." Now to the 7 silent symptoms most doctors miss. Symptom 1, brain fog and memory problems. This is one of the most underestimated and frightening symptoms. Women describe it as, "I can't remember anything. I constantly lose my train of thought," or "I feel like I have early dementia." Estrogen plays a critical role in cognition, memory, and neuronal communication. When it drops, signal transmission in the brain slows down. Studies show that up to 60% of women in menopause experience cognitive changes. The good news, for most, it's temporary. Once hormones stabilize, cognition improves. Symptom 2, mood swings, irritability, and anger. Suddenly, you have an extremely short fuse. Small things that wouldn't have bothered you before, a spilled glass, an innocent comment, make you explode. Then you feel guilty and wonder, what's wrong with me? Progesterone has a calming, anxiolytic effect on the brain. When it drops, you lose that natural buffer against stress. At the same time, fluctuating estrogen makes your mood regulation unstable. This isn't a character flaw, it's neurochemistry. Symptom 3, anxiety and panic attacks. Many women experience anxiety for the first time in their lives during menopause. Heart racing, tightness in the chest, a feeling of impending doom. All of this can come out of nowhere. Estrogen influences serotonin, GABA, and other neurotransmitters that regulate anxiety. When estrogen drops, these systems become destabilized. Symptom 4. Insomnia and night sweats. Night sweats are notorious, but even without sweating, many women have sleep disturbances. You can't fall asleep, or you wake up at 3 a.m. and can't get back to sleep. Estrogen and progesterone both influence sleep architecture. Low progesterone makes it harder to fall into deep sleep, and low estrogen contributes to nighttime waking. Symptom 5. Joint pain and muscle stiffness. Did you know that estrogen has anti-inflammatory properties? When it drops, inflammation rises throughout the body. Many women suddenly develop pain in their hands, knees, shoulders, often worse in the morning. This is often dismissed as arthritis or just aging, but it's often hormonal. Symptom 6. Weight gain, especially around the belly. Despite unchanged diet and exercise, you're gaining weight, especially around the waist. Estrogen influences where fat is stored. Before menopause, women store fat in hips and thighs. After menopause, it shifts to the belly, similar to men. This isn't just cosmetic. Visceral belly fat increases risk for heart disease and diabetes. Symptom 7. Changes in libido and vaginal dryness. Low estrogen leads to thinning and dryness of vaginal tissue, making sex uncomfortable or painful. This, combined with hormonally driven low libido, can make intimacy challenging. Many women feel guilty or defective, but this is a direct hormonal issue, not a psychological one. Back to Mary. After I explained her hormonal changes, we developed a plan. She stopped the antidepressants, and we implemented the natural protocol I'm about to give you. After 3 months, the transformation was remarkable. She said, "I have my mind back. I'm sleeping again. My students have their patient-teacher back. And my husband has his wife back." She learned that menopause isn't the end of something, but the beginning of a new phase that can be navigated with the right knowledge. Now to the 90-day balance protocol. Pillar 1. Blood sugar stability. Insulin resistance often worsens during menopause and exacerbates hot flashes, weight gain, and mood swings. Eat protein-rich meals. Start every meal with protein and healthy fats to prevent blood sugar spikes. Avoid refined sugar and white flour. Incorporate fiber, vegetables, nuts, seed. Pillar 2. Phytoestrogens and hormone-supporting foods. Certain foods contain plant compounds that have gentle estrogen-like effects. Flax seeds, 1 to 2 tablespoons freshly ground daily, proven to reduce hot flashes. Whole soy foods, tofu, tempeh, edamame, chickpeas, lentils, cruciferous vegetables. Broccoli, cabbage, support estrogen detoxification. Pillar 3. Strength training and weight-bearing exercise. Estrogen protects bones. When it drops, bone loss accelerates. Strength training is non-negotiable, 2 to 3 times per week, with weights or body weight. This not only maintains bone density, but also improves mood, sleep, and metabolism. Pillar 4. Stress management and sleep hygiene. Chronic stress raises cortisol, which further lowers estrogen and worsens symptoms. Daily meditation or deep breathing, 10 to 15 minutes. Sleep hygiene, cool, dark room, no screens. 1 hour before bed. Pillar 5. Targeted supplementation. Vitamin D3, 2,000 to 4,000 IU daily, supports mood and bones. Magnesium, 300 to 400 milligram, improves sleep and reduces anxiety. Omega-3, 2 grams EPA/DHA daily, anti-inflammatory, B-complex vitamins, support energy and nervous system. Pillar 6. Selective use of herbal remedies. Black cohosh can reduce hot flashes. Vitex can help with cycle irregularities in early perimenopause. Rhodiola and ashwagandha, adaptogens for stress management. Always discuss with a doctor, especially if you're on medications, when to consider hormone replacement therapy. For some women, natural methods aren't enough. HRT can be life-changing, especially for severe symptoms. The latest data shows that bioidentical hormones, in the right dose and started at the right time, are safe and effective for many women. This should be an informed decision with a menopause-specialized physician. In conclusion, I want you to understand, menopause is not a disease that needs to be cured. It's a life stage that can be navigated with knowledge and support. You don't have to suffer. You don't have to feel lost. With the right approach, you can go through this phase with energy, clarity, and confidence. If this video has given you hope and understanding, do 3 things. Subscribe for more science-based women's health content. Share this with a friend, sister, or mother who might be suffering. And start the protocol today, not tomorrow. Your best version is waiting on the other side of this change. I'm Dr. Michael Turner, and I'm here to guide you through every step. Until the next video.